Good morning, everybody. My name is Mary Wallace, and I am with Schuler Bauer Real Estate Services, and you are tuning in to Real Minutes with Mary, which is real people in real time with real information. And so this morning I have with me, if you can see it behind me also, and next to me is Dr. Rita Fleming. And she is running for Indiana State Representative.
That's right.
And I think that's also District 71. Is
That's
that correct?
Mary? Yes.
All right. And refresh my memory. I believe District 71 covers what cities, what areas?
District 71 is Clarksville, Jeffersonville, and much of Utica.
Okay. All right. So three good sized pieces of Clark County. So anyway, Dr. Fleming is here with me. Thank you for joining me today.
You're very welcome.
And I just kind of want to start out. I was just really curious. Tell me a little bit about your academic credentials, where you did your postgraduate work, and what your doctoral credentials, what it's in, and where it came from.
Okay. I started off as a nurse, actually. I went to Murray State University, got my bachelor's degree in nursing, worked as a nurse for several years. I wanted to expand my role as a nurse, so I commuted to Vanderbilt University from Murray and got my master's in nursing, became a nurse practitioner.
Okay.
I loved being a nurse practitioner, but it was the mid-1970s, and not everyone understood what a nurse practitioner was. It was very restricted in what you could do, really couldn't be reimbursed. And although I truly loved it, I felt that the way I could best take care of the people that I wanted to care for was by being a physician. So again, packed up my family and moved to attend the University of Louisville and get my medical doctor degree.
Okay, so that is actually a medical doctor. Sometimes
when
you say that, you're not really sure what the designation is in. So anyway, well, so you have a long history of serving people.
Yes, ma'am. Yes.
And for this particular position that you were running for as state representative, certainly she has a lot of hands in District 71 to care for. So how long now then have you lived in Clark County?
About 33 years.
Okay, all right. So you're not a newcomer to
That's
the
right.
area. And tell me what you love the most about living and working here in Southern Indiana.
Well, I like the quality of life in Southern Indiana. Mm-hmm. And I mean that things that you can do in Southern Indiana, the way you can live in Southern Indiana, but most importantly, the character of the people itself. I find it to be a very friendly place, an accepting place, a diverse area. My family and I were very comfortable raising our children and going to school and working in the area known as District 71.
Okay, all right. So it's been an area that not only you're looking and hoping and praying to serve, but it's an area that you've certainly lived in as well.
That's right. Yes.
That's awesome. So
thank you.
Other than, I think you've kind of answered my next question, which is, what other employment are you or have you been doing? So we certainly know that you have been in the nursing and being a doctor in our area. But currently now you are full-fledged public servant, correct?
Well, I do continue to work. In fact, I left work to come here this morning.
Okay.
I deliver babies, and that is the most joyful occupation that one can have. It's a happy time most of the time, and it's something I truly love doing. If elected to office, I will continue to work, but I will only work part-time, and I have a very flexible schedule. I no longer have my own office. I used to work 24/7, did that for years, delivered more than 95% of my babies, but I'm in a situation now that I work 24 hours in a set place. I'm an emergency obstetrician, essentially, and I can do that part-time, but still devote a lot of time to being state representative.
Oh, okay. You and I were talking just briefly before we started, and you were talking about the babies, and I will try diligently not to choke up here, but why this path? Why running for state representative? And we were talking about us as just residents of Clark County and residents of, people that we call ourselves American, but we really have find ourselves getting so busy just kind of surviving and taking care of our responsibilities that we totally forget of the importance of voting, of the importance of having a voice, not only for my generation, which, is more in a third season than in a beginning season, but here you are delivering new life that public policy is going to affect over the course of their life. And certainly I have generations of my children and grandchildren that if we're not paying attention, folks, that, you don't have a voice and they're not going to have a choice. So let's be mindful of not only the blessing and the privilege of being able to vote and have a voice here in local elections as well as our national elections, but let's get more informed. That's one of the reasons why Real Minutes with Mary kind of began, was just to help get people information. So let's talk about what you see are some of the top issues maybe that you will be faced with, or that you would like to actually bring to the forefront in the State House.
Okay. And first of all, thank you very much, Mary, for reminding people of how important it is to vote, because there's a lot of ways to let our voices be heard. And I think that voting is the most important way. You can even vote early now. You don't have to wait for Election Day. Issues in our area, I think our health care is paramount. That is one of the main reasons I'm running for office. And I'm dealing with the very smallest individuals. I deliver babies. I'm working with families. And I want to make sure that we have quality health care, but that it is affordable, that we are financially responsible, and that we all realize the importance of taking care of ourselves, because it's much better to prevent problems and much more cost effective than it is to have a disaster and then end up in a hospital or end up with a very altered lifestyle because you're not healthy.
Yes. So healthcare being certainly top of mind to many of us, not only on a state level but on a national level as well. Right. So that is definitely a topic that needs a voice. So as you've been canvassing in the areas and in the neighborhoods, just on a local and small scale, is healthcare one of their primary concerns, or are you finding some other issues or having some other questions?
Far and away, healthcare is the number one issue that people want to talk about, and they have their specific aspects of healthcare. For example, pre-existing conditions is something that people are becoming more aware of, and how that could affect their ability to gain insurance and to access health care. I want to remind people, particularly women, 1 in 8 women in the United States will get breast cancer at some point in her life. That is a huge number. That is considered, if you're 35 years old, you're a mother of 2 children, and you find yourself now faced with a diagnosis of breast cancer, you don't want to be uninsured for the rest of your life because you have that pre-existing condition. That's very much on people's minds. I think the other thing is that insurance is important. We all have to have car insurance. That not only protects us, but it protects other drivers. Everyone needs health insurance. This protects us. When someone comes to our hospital, Mary, we don't turn them away. We must take care of them. If someone comes in labor, I'm going to deliver her baby. I'm going to deliver her the best care that I can. But that can be very expensive. And if that person doesn't have insurance, you and I pay for that, Mary. It's not free.
No, there is a cost. There is a cost.
Right.
Somebody's paying the price. Wow, that's very, very insightful, and thank you very much for being expressing that passion. I hope you heard it as well, about the the concern of pre-existing condition. I personally can't say that I've ever thought the depth of that, but only those that have been touched with something as debilitating as cancer, or something as debilitating as a stroke, or those things tend to follow you from an insurance standpoint. So I can't say that I had ever thought about the depth of that repercussion. So I really hope that all of you listening out there really understand and take to heart the issues that our public officials are not only faced with, but actually challenged and commissioned by those of us living in their communities. So thank you again.
Sure.
So tell the viewers that how they can get in touch or connect with Dr. Fleming, and how they can ask questions if they have questions before we actually hit the polls. Right. How can our viewers connect with you?
In a couple of ways. We do have a website. It's called Fleming for Indiana.
Okay.
And you're welcome to initiate any discussion, ask any questions. But I think we need to meet face-to-face with people as well. Mm-hmm. So I hope that you've seen me at your door. I have gone door to door in thousands of people's homes, and really appreciate the conversation and discussion that we've had there. Another way, too, is I will be at Pearl Street Coffee House in Jeffersonville. I'll be there tomorrow from 8 a.m. until 10 o'clock. Also on Saturday, I'm going to be at the Heine Brothers Coffee House on Veterans Parkway. Okay. And I'll be there, I think, from about 9 until 11. I want to give people the opportunity to wake up and come in and grab a cup of coffee and sit down and talk with me.
Well, that's two great opportunities to connect. Say that again. It's tomorrow at Pearl Street Coffee House. From what time?
8 until 10 a.m.
8 until 10 a.m., so tomorrow morning.
Right.
And then when is Heine Brothers again?
Saturday morning, Heine Brothers on Veterans Parkway from 9 a.m. until 11 a.m.
Awesome. What a great opportunity to
buy you a cup of coffee.
to meet the neighbors, to meet those that are going to the polls. And once again, I do encourage all the listeners that whether you vote early. Speaking of which, do you think that the push for voting early is maybe to help improve some of those voter turnout numbers?
Absolutely. And we're seeing great results. We're seeing a lot of people who have either voted by mail, absentee ballots, which is made easy in the state of Indiana, or going to the polling place on Court Avenue, open from 8 until 4 Monday through Saturday. And now you can vote at the 4-H Fairgrounds until 7 p.m. during the week. Great opportunities. No one has an excuse not to vote now.
Very, very good opportunities to vote. So let's be sure that we all exercise that privilege and blessing. And I want to thank everybody for listening to Real Minutes with Mary, which is real people in real time with real information. Thank you, Dr. Fleming.
You're so welcome,
for spending
Mary.
A few minutes with us this morning, or with me this morning. And you've heard how you can connect with Dr. Fleming. But if you're looking to buy or sell here in Southern Indiana, my name is Mary Wallace with Schuler Bauer Real Estate Services. You can connect with me by email at marywallace@schulerbauer.com, or homesforsalebymary.com. Or if you'd like some instant notifications and have my mobile app right in hand, text me at 812-416-0527, and I'll be happy to send that link to you. So once again, thank you for listening. We're going to have another Real Minutes with Mary this coming Thursday. I'm not certain of the time, but I'm really excited for you to meet Miss Victoria Hare. So that will be this coming Thursday. I'll be live in Jasper, Indiana. And so look forward to talking with you again this Thursday. But again, be sure to get out and vote. Thank you, Dr. Fleming, once again.
Welcome, Mary.
And everybody have a great day.
Thank you.